In 2022, NORD announced its inaugural program of establishing a network of centers of excellence across the US. There was a rigorous application process, and UT Southwestern was honored with being included in the group. There are now 31 centers in the US, that's in 21 states and Washington, DC. The program officially launched at the beginning of November of 2021 and is still forming. It's still getting off the ground. We're still figuring out what works and what doesn't work, and what's feasible and what's maybe not feasible. NORD certainly is well established. It has already, over the decades, laid groundwork for many of the things that the centers have been trying to build on. NORD states that the goal of the Rare Disease Center of Excellence program is to foster knowledge and knowledge sharing across all rare diseases and across the country. And we want to improve the pace of progress in rare disease diagnosis, as well as in treatment and in the research that supports both of those things. What UT Southwestern has as an advantage is that we can care for people throughout the lifespan. We have relatively integrated programs for rare disease, both in pediatrics and adult, and in some of the, if you'll excuse the way I say this, more common rare diseases. We actually have standardized programs to move people from their pediatric care system into an adult care system. The thing that UT Southwestern is best known for is its work in lipid metabolism and cholesterol diseases. We have Nobel Prize winners. We have members of the National Academy of Sciences who have studied those conditions for decades. The offshoots of all of that are very strong at UT Southwestern. We also have a broad Cancer Institute, which deals certainly with the more common cancers, the leukemias and the colon cancers, but also with rare and unusual cancers fairly aggressively. In pediatrics, we can address many things. We have among our institutions one of the busiest delivery hospitals in the country at Parkland Hospital. And as you can imagine, the children who are born there have a wide variety of problems, both individual birth defects as well as rare genetic diseases and other problems. We have high-level newborn intensive care units, both in that hospital and in the children's hospital. There is some concentration on neurologic diseases of children, and a very heavy concentration in inborn errors of metabolism. We are a center for referral for our state newborn screening program and have a broad faculty, both in the clinical area and the research area, that look at and care for metabolic diseases.